There we go.
Hey guys.
Hey everybody, it's Patrick, and it's after work. And today I have a trainee. This is Susanna.
Hi. Patrick showed me all his therapeutic conversation skills and professional demeanor. And I got to see some cool stuff.
So, what kind of stuff did we see?
Well, I don't know if we can tell.
Oh, well, we did CAD pump. We did the computerized automated delivery device or whatever for pain medication infusion, and that's always fun to play around with because there's lots of troubleshooting and it can beep and go wrong. And we just did some troubleshooting today with it, and it's very satisfying when you get it up and running and it stops making that beeping sound at you. Like everything's nice and peaceful.
Yeah, so that was cool. And he showed me his computer and how he remotely connects. And that was pretty much it.
So what do you think of hospice care in general so far?
I think it's pretty rad. Yeah, it's important work.
And how is it different from what you did in the VNA before?
The focus of the care was completely different.
Really? What do you mean?
Well, with VNA, the focus of the care is to restore to optimal level of functioning. And it is also the same with hospice. However, some of the
expectations are lower.
The patients are at a different place where they are able to fully understand their health and what is to come in the short term.
Yeah.
So it's a nice contrast.
I don't get a lot of feedback. What do you think of my assessments in general?
I think that you are a smooth operator. Yes, those ladies love you, Patrick.
Yeah, it's like weird being out in the field. I don't get a lot of feedback on that stuff, so I really like having other nurses come along with me because I get like an outside perspective.
Yeah, I think you did a good job.
Very good.
Yeah. So that's it.
Met some colorful characters and had some fun conversations. I mean, did you feel? I mean, you were comfortable going into people's homes anyway, right? Like,
yeah.
Get in there and talking to people and making small talk and stuff.
I like to get up in there and find out about people and see what they do.
Yeah.
I like hearing about all the kids.
Yeah, we got shown some family photos today. That was kind of cool.
Yeah.
Like everybody always wants to show us pictures of their families.
It's good to get a perspective, on who you're dealing with.
What kinds of things would you like to see more of in orientation, or do you want to go over in more detail?
I think that I'm going to need I need to actually start working with the computer, and I'm going to have to learn how to use my new phone.
Oh yeah, they give you an iPhone, huh?
Yeah, they did. They gave me an iPhone, which I'm very familiar with, but I don't know how to do email blasts and things like that, so everybody can hear from me at all times. I'm sure they're going to really want that. So, but yeah, just kind of like some familiarity training.
I mean, you'll get a lot of that stuff as you just shadow other nurses and follow around, but what about you did a lot of wound care in the VNA, right? You're pretty comfortable with wound care.
And before that, I did.
Yeah.
I like wounds.
Cool.
I like big, disgusting wounds.
You'll get them. You'll get them, for sure.
Yeah. It's also interesting to see the different supplies that people use. There's less with hospice, obviously, because we're not trying to cure, we're trying to...
Yeah, I mean, I've run into at least one of everything. We have a patient in our census with a wound vac right now, so we do get a wound vac once in a while. Not very common, not very regular, but we do get it occasionally. And sometimes we'll inherit cases from the VNA, so we'll get to see what kind of equipment they left off with.
Right.
But when somebody's on the hospice benefit, pretty much whatever they need within reason, we can order for them. So if they need Medi-Honey or calcium alginate or whatever kind of exotic stuff, we can get all of that. And we've also got a wound and ostomy nurse that we can consult with at one of our local hospitals. One of the CWONs is one of our per diems or whatever, and we could call her and ask for a wound consult, and she provides the most awesome wound write-ups. It's I sent her over to look at people's skin, and she sent me back a 10-page academic quality write-up on this one individual person's wounds and what she thinks will be the best way to treat them and what her rationale behind her thinking is. And we get some really good write-ups. The speech-language pathologists, too, if you ever have to call them the speech-language pathologist, they make great write-ups. It's kind of neat to read those high-level assessments because are they feeling, you know, but, you know, we really don't get into a lot of that all the time, but sometimes we need to. Like I have, you know, one patient with a degenerative neurological disorder, and so the kind of write-ups and assessments that we get on that particular person are like more in depth than what would normally be needed for, like, say, somebody with just Alzheimer's dementia or whatever, where, you know, getting in depth with that kind of stuff isn't our focus. What other fun stuff have I seen? I haven't seen any Dakin solutions since I started working here.
Oh, yeah?
I have seen quite a bit of Hydrophera Blue. Do quite a bit of Hydrophera Blue. I've seen some Medi Honey.
Well, Hydrophera Blue, I do not like that dressing. I feel like that is an appropriate dressing if you are in an acute care facility and you've just had surgery. A lot of surgeons like to use it. But I don't think that it's a great dressing to use in a SNF or in home care because we don't have the kind of time to do the dressings, you know, frequently because it needs to stay wet. And the other thing I have to say about Hydrophera Blue is that a lot of people do not know how to correctly use it. It needs to be cut to the wound bed.
Right.
And if you put Hydrophera Blue on intact peri-wound skin, it will macerate it and destroy it. So I've seen a lot of wounds get worse, actually, when people do not know how to use the dressing.
So you've seen it do more harm than good, then?
That's affirmative.
Interesting.
So I think there's a lot of better alternatives. I like the calcium alginate silver or
the calcium AG or whatever.
And also Medi Honey's great stuff. They have it in an impregnated pad and they have it in a gel.
Oh yeah, I've seen that. It's like a tube of gel with Medi Honey.
And it's a great debrider. It's a little slower than Santal, but it works really good. So
haven't seen too much Santal.
Yeah, it's very expensive. It's $100 a tube.
Really? Those little tubes are $100?
Yep.
Wow.
Yep. And what's the other one they like to use is Zeniderm. It stimulates blood.
Yeah.
But it is over the counter now, but it is also $50 a tube.
Oh,
That's something you see kind of sometimes people will put it on heels or maybe on coccyx.
Oh, right. Yeah, I've seen that in the nursing home.
Yeah.
Do you have any special tricks or words of wisdom for treating like hard to bandage areas like the sacrum or the natal folds?
Well, with the natal fold, sometimes you need to cut the dressing so it has the room to move. And sometimes you just have to keep reinforcing it. Or sometimes it just won't stick no matter what you do. You just have to change it frequently.
I've been seeing a lot of people like just try to approach it with just creams and positioning to try to keep people off areas.
Yes, that works really well. And triad paste is actually dressing. I don't know if you're familiar
triad
with that.
paste. That's it's like a zinc and dimethicone and something like that.
It's like a very fancy diaper cream.
Yeah.
It actually is considered a hydrocolloid dressing.
Right, hydrophilic dressing or something, or no, hydrocolloid dressing.
Yeah. And so you can actually apply that paste on somebody's skin, and that is considered a dressing. However, most people don't use that one correctly either because it is supposed to be remaining on the wound bed.
Yeah.
So unless it is grossly soiled, you do not remove it at each diaper change.
Oh, okay. But is it like really sticky so it doesn't come off when you reposition, or is it you got to keep putting it on?
It's like a dry, thick paste. So you could definitely leave it, but most people think they have to clean the skin all the way down.
Oh, so they wipe it off.
Really, and wound beds should not be disturbed. So, but it does work good, and that is a good alternative to a wound that is somewhat small.
Yeah.
Obviously, if it's bigger, open, it's not going to work.
Now, I run into a lot of cases where you've got somebody who sleeps up in a recliner every day for like the rest of their lives, and their butt's turned into hamburger, and what do you do about it? You know, like
they got to go to bed.
Yeah.
That's the only way you can do it.
Right.
And they need to be put in bed after they eat, you know, have limited time up on their bottoms. Because there's like pressure areas there, and they have a little device that a lot of the bed people or people that sell medical equipment have, and they can actually show you where the pressure points are in any particular chair. Yeah, and so it lights up with color.
Lights up with color? What do you mean?
You put it under their bottom, and then on the screen it'll show.
Oh, it'll show you like a heat map of where the pressure is.
So you can use that to determine like if the wheelchair cushion is appropriate or if they need to change it. But really, you can't be on your butt 24 hours a day and have it not break down. Even if you're continent.
See, I try to explain this to people, but still sometimes they will say that they don't want a hospital bed and their plan is to stay in their chair for the rest of their lives.
Well, it depends how long the rest of their life is and how comfortable they really want to be, you know?
I think, one of the things I've had to get a hold of in this job is that, working in home care, I can't tell people what to do. Sometimes I just have to accept that what they want is not what's best for them.
Right. And that's their choice.
Yeah.
You just have to document it.
Yeah.
Education provided.
I think working in commissioned sales has really helped me get ready for this job. Being able to talk people into things.
Really?
Yeah.
You know what helped me was being a waitress.
Oh, I'm sure. Yeah. But when I worked in commissioned sales, it was talking people into things so I'd make a higher commission. But now it's like giving people options and educating them about their choices.
It's good that you've used your evil skills.
My evil skills for good. Yes, my evil salesmanship skills have been used for good.
That's admirable, Patrick.
Yeah, well, glad you think so.
All right, well,
that is
let's
it.
end our day.
Good game.
Yep.